You've been doing some research on bunions when that big toe moves over, maybe over the second toe, under the second toe, and you're wondering about the risks and benefits. Well, I'm about to tell you. Watch this. Risks and benefits of bunion surgery. I always emphasize that it's very important to find out your risks and your benefits when you're advised or recommended to do anything medically, anything that poses a potential risk to your health, to your well being, to your quality of life. And what are your benefits? Do the benefits outweigh the risks? Do the risks outweigh the benefits? It's important to ask that question. You don't need to be a medical professional to understand your risks and your benefits. It's a simple pros and cons list. That's all you need. But you need to be fully informed before you decide. So we're going to look at some of this. I've worked with so many patients post bunionectomy, and it is a very inconvenient surgery to have because you're non-weight bearing. You're using one of those little scooters to bend and rest your knee on as you move around on the wheel on the one side of the body, or you're using a walker, you're using surgical shoes, use crutches, something that's helping you to walk for many, many, many weeks after surgery. Now, there are a lot of new things that are coming out where they're saying you can weight bear right away after surgery, minimally invasive. They're constantly working on new procedures. I haven't seen data on the new procedures, so that's why I'm not presenting on them, because people can claim a lot of things. Testimonies don't mean anything. We need to see, is it working? Is there a recurrence? Does it actually fix the problem? So I'm going to present on what there's some data on so that you can see and compare for yourself. So let's look at the risks and benefits of bunion surgery. Now, the type of surgery depends on a few things. How severe is it? Is it mild, moderate, severe, or a lot of arthritic damage in the joints? What's the age of the patient, the general health, their activity level, and overall bone and connective tissue condition? Because if the bone is really not healthy, they're not going to want to be putting screws in it after they straighten everything out, because it may not hold. It may end up just sort of falling apart, literally, depending on the condition of the bone. So all of these things are taken in as factors. And then the surgeon will decide what type of surgery that he does, whether he does a fusion or even a full-blown joint replacement implant. Now, there are four major types of surgeries, and the most common is the exostectomy, but it's rarely performed alone. Usually an osteotomy is included, so I'll describe these just a little bit to you. The exostectomy is a procedure that involves removing the bunion itself, that bony bump at the base of the big toe. And the goal here is to straighten the toe. So a lot of the times this exostectomy is not done alone because it doesn't straighten the toe. So surgeons will usually pair it with an osteotomy, which does realign the toe joint. And to describe the osteotomy, that is when the orthopedic surgeon cuts into the big toe joint and tries to realign it with screws and plates. That's the goal. And arthrodesis that's if there's arthritis that caused the bunion, or arthritis damage is seen in the joints. Now, we don't know what came first, the chicken or the egg. The bunion could have caused damage to the joint, vice versa. They could have been happening side by side, neither one causing the other. We're kind of assuming things here. A lot of people have bunions with no arthritis in that joint. So why are we just assuming the arthritis caused the bunion? That's a question. However, the surgeon removes the arthritic portions of the joint and then tries to realign it with screws or pins, which you can see here. And then the resection arthroplasty, that's where it involves removing the toe joint damage, which causes a flexible scar joint to form. Now, I do want to emphasize here that a lot of patients have concerns about the cosmetics of their foot. What does their foot look like? It's not a pretty picture when those toes are pointing in. You got that big bump. Sometimes the big toe will cross right over or under that second toe. Not really pretty to look at if you happen to be on the beach. And so but the issue here is that surgery, it's not for the cosmetics alone. That's not an indication for surgery. The goal of surgery is pain relief. And here's the kicker. The cosmetic concerns, the footwear difficulties can even persist after a successful surgery, including pain. So, yeah, not and you're thinking, but I thought that's what it's supposed to take care of. Well, sometimes it does, sometimes it doesn't. Let's look at some things. Now, before we get into the risks, the recovery time, 6 to 12 weeks in a surgical shoe or a boot. Now, like I said, there are some new procedures coming out. I'm not reporting on those because there's no data yet that's looking at that objectively, as far as the results, the efficacy, the risks, those kind of things. But for the typical surgeries that are still being done now, weight bearing is dependent on the type of procedure that was done. Typically, the person will use crutches or a scooter or a walker, and then they'll resume all their activities in about 3 months, which is about 12 weeks. Swelling may occur for 6 to 9 months post-surgery, depending on how much you're on your feet. And that's the body has this immune response to trauma. And so it will send fluid to a traumatized area. Surgery is trauma. I remember many, many, many years ago when I was in a car accident and I ended up with a broken ankle. It was 9 months later, if I was on my feet for long periods of time, that ankle would swell. No pain. I didn't even know it was swelling. Someone would point it out to me if I happened to be wearing a skirt. Your one ankle's bigger than the other. So, I wasn't even aware of it. But that's the body. That's kind of a normal thing. That's not the surgery's fault. Okay. Now, let's look at the risks. You can see I highlighted here bunion recurrence. Yes, it does happen. And it's kind of sad that it happens because once you've had that surgery and all that inconvenience and all that pain and all that healing, you really don't want to have it again. There's also some other risks, ongoing pain. The pain is not always resolved with a bunionectomy. The stiffness, sometimes that gets worse because the toe, the way that it's corrected surgically, doesn't provide that movement that's designed to be at that joint when everything is working optimally. And so that will make it very stiff, very challenging to have any kind of a toe off during gait, and gait will be impacted in a negative way. Any surgery carries risks like, nerve damage, wound healing problems. Those are huge because it's the foot. The feet, I believe it's, because of where they are, you can have some issues there. And then overcorrection, the big toe extends away from other toes. Now, this would be a surgical issue. I'd like to think that most surgeons don't do this, but it can happen. It is one of the risks. I do want to also emphasize smoking is a contraindication to surgery because it's associated with increased wound complications, delayed union following the osteotomy, so the joint doesn't really have a good union there, and poorer patient reported outcomes. Now, this is the same for almost any surgery because smoking does inhibit proper oxygenation of the cells on a cellular level. And that's because it is, I won't get off on that tangent. I could go into the details of why that happens, but everybody's aware that smoking impacts and impairs circulation. So that's why you can have some increased risk of wound healing issues. All right. Efficacy. This is what we want to know. Okay. How effective is it? Well, surgery straightens out the toes and the midfoot, bringing the bones back into the correct position. Symptoms often improve as a result of this, and a lot of people can use their foot in a much healthier way, find it easier to walk after surgery. But Some are disappointed with the outcome of surgery. For instance, their foot still hurts, they still have pain, or because they can move their foot even less than before the surgery. Bunion surgery usually causes the joint at the base of the big toe to stiffen. A lot of the times it's because it's fused or there's a screw there that's stopping it from moving. But even if they don't surgically prevent movement there, a lot of the times that surgery does cause that joint to stiffen and lose range. So it becomes harder to do things like rolling your foot in a nice smooth heel to toe movement during gait when you're taking a walk. Now, I spent quite a bit of time looking at studies, looking for studies to show me data concerning efficacy. How well does this kind of surgery work to resolve the problem? And all I could find was studies that compared different surgical procedures with each other. And there was one study that attempted to compare it with non-surgical, but there was no data. They just kept reporting no data, no data, no data. So they couldn't even do it. And they were doing a review of the studies. So the results suggest that the commonly used approaches, those ones that I just talked about, are similarly effective. So basically, they all work about the same. And the recurrence. Bunions may form again after surgery. So I just really wanted you to understand that you can do this non-operative management, but ideally, let's figure out what's going on with the mechanics of the foot. And there are experts who are saying that if you can pull the big toe away from the other toe, that means that uh, hallux adductus longus muscle is allowing that toe to come out away from the second toe, then it's possible to reverse the bunion. It's possible. It might be time consuming. It might take up to 3 years, but the experts are saying it's possible. So I'm doing more deep diving into this because this subject impacts 25% of the population. That's huge. And the fact that it often ends up in surgery and surgery that may or may not work to resolve the issues and the problem may recur, that's not a good outcome. So I hope you found this informative and helpful. And I will see you at another event that I host, wherever you may show up in my world. If you enjoyed this, please hit the like button, hit the subscribe button. It's important so that you'll know when other information comes out. And I hope to see you soon.